Marty McCary with Johns Hopkins thinks we'll get there by April.
Johns Hopkins University Medical School of Medicine.
About the spread of COVID-19 in classrooms.
Johns Hopkins COVID-19 vaccine study at Johns Hopkins School of Medicine. Thank you so much for joining us.
I got COVID and then I was isolating in my own room for about 3 days and kind of had a system set up, but then they decided to have us move to the colonnade midway through having corona. The whole process was just super rushed. Like, I got a phone call that day that I had to be moved in like 2 hours to like pack up everything. I didn't really feel well and it was very isolating, and I kind of just wanted to be in my own bed like I was in, and I just like really didn't feel well throughout the whole process, so it was a little stressful like while having symptoms. And for like the first few days, and we were kind of just getting a lot of emails during that time and not really anything in terms of like, if you need to talk to someone right now or if you need support, like here are the resources. It was a lot of kind of finding out how everything happened. And I think like those couple of days were definitely the point in the semester that was like hardest for me mentally. And I was just like counting down the days till I could like go back to my room and do school from there instead of at the hotel.
I feel like I received more information from like the student government people rather than administration itself. And decisions were also like, again, sent out very late. Like even the decision that we were having in-person classes was extremely late, to the point where getting prepared was very difficult. And I remember that I severely underpacked when I actually arrived here for the spring semesters.
Everyone kind of was confused what was happening, and it was understandable that the school was kind of delayed in responding and like what the fall was going to look like.
In terms of like being president of a student group, I think that the rules and regulations over the last year that I've had to enforce has been very stressful, because I don't always know exactly what to tell people, because I don't always know exactly what's allowed, because things are constantly changing, or the person who is telling me these rules doesn't have the answers to all of my questions.
I think the most frustrating part was the whole housing timing and the announcement of online classes versus in-person classes, especially last fall. I happened to have signed a lease and then found out all my classes are online, and I don't know if it would have been different knowing what that semester would have looked like, or if I would have committed to a lease knowing I wasn't going to be able to use any of the facilities on campus.
At the beginning of the pandemic, a lot of the messages were sent out pretty late, and I remember like a lot of the students in our group chats, we were like always anticipating when a response would be sent out.
I think the most effective part that the administration kind of mandated was the testing aspect.
Mandatory testing and mandatory vaccination.
I think the Prudensity has been effective, especially at a time when there weren't vaccinations. Having the security and knowing that the people that I'm surrounding myself with are COVID negative.
I felt a lot safer being around people I knew who were getting tested through the school and had to have a negative test in order to be in whatever environment. And the whole pro-density system makes a lot of sense. In order to be on campus, you have to make sure you don't have symptoms and you don't have COVID, and that totally makes sense.
I would say something that I don't think is very effective is pro-density. But no one's going to answer no on pro-density because they have a cold, because then they can't go to class. They know they don't have COVID because we're getting weekly tests. So I think pro-density is like one thing that is not really helping anyone.
I think something else that was frustrating was just the total transition of what it was like learning online versus in person. This past year, or like the one that happened before, was very hard mentally.
It definitely did take a toll on my mental health. Like, it was kind of isolating, a little bit like depressing. Some people did make connections over like virtually, but I think it's very difficult. Like having all your club activities virtual, having all your meetings virtual and like classes virtual, it's just not the same. You just cannot make connections the way you do in person.
I didn't feel like I had that many support resources while I was going through all of it, in terms of like the counseling center is kind of delayed if you wanted to speak to someone, and now that people have outlets of like going to things in person and like have hope that it's getting better, it's definitely improved. And I think a lot of people have now seen like the necessity of finding someone to talk to and really prioritizing mental health, because it affects everything you do in college.
Some of the policies can be a bit like too much, excessive. For example, like the 8 p.m. thing where we can't enter other dorms after 8 p.m. Considering everyone's vaccinated, we're already interacting with each other before 8 p.m. So what is the difference in allowing us to interact with people after 8 p.m. in other dorms?
And I think it made total sense that health was #1 priority in the Baltimore community and the Hopkins community.
But it's more about like the repercussions you face after. Like they just want to be there to enforce things when something bad happens. They give the appearance that they are helping the world and they are providing all this great research and data, but I don't think that they are there for their students.
I think it's interesting to see how students at Homewood truly feel about Hopkins administration. I think it is clear that there's a lot of resentment for the lack of resources, especially mental health resources, for the poor communication, and for the intense and strict rules that have stopped making sense. Although students understand and agree with the importance of keeping the community safe and applaud the availability for testing and the mandatory vaccination policy, they feel unheard and uncared for. I think it's sad to see that students feel that the leading institution in research and COVID information hasn't given them their place and has cared more about their reputation.